Hello, welcome everyone. Thank you for joining us this afternoon. Welcome to the special coronavirus edition of the statewide staff meeting. I actually am going to take most of our time today to talk about that issue. We've gotten lots of questions about it. I know many of you have gotten lots of questions about it. The public has showed up at some of our county health departments asking for coronavirus advice and testing and lots of other things. I know that's something that we hear about a lot on the news, and you're probably getting a lot of questions about it. So I really wanted to use our time today just to give you an overview of what we've been doing here, trying to prepare for coronavirus cases if and probably when we see them. We certainly want to plan to leave time today for you to ask questions as well, and we get lots of questions, and I know you do, and I would like to hear any that you have that we can try to answer for you. As you probably know, in late December of this past year, these cases of this new, never-before-seen coronavirus started showing up in central China in a city called Wuhan, and it was associated with a live animal market and seafood market. And then by early January, it became clear that there were literally thousands of cases of illness, which were similar in a way to the flu. People had respiratory tract symptoms with cough and congestion and shortness of breath. But in many cases, these were very serious illnesses that led people to be hospitalized and even to die. At first, it wasn't clear that this wasn't just some strain of flu, of influenza, but really within a couple of weeks, the Chinese authorities had discovered a brand new virus that no one had seen before, and really it took only a few days before that virus was identified and the genetic code was identified, and a test for the virus actually was available really about 2 weeks after the virus was discovered, which is really just a remarkable thing. But even though the Chinese government tried to close down the city and close down that province and keep the virus contained, it has in fact spread and now has shown up in 60 or 70 countries around the world, including here in the United States. What we're seeing now in the U.S. Is somewhere over 130 or 140 cases, maybe more, because that number seems to be changing almost every minute. About a quarter of all those cases are Americans who were on the Diamond Princess cruise ship. I'm sure you heard that story of the people who were quarantined on the ship, and there were hundreds of people who got infected. There were some deaths, in fact, associated with that ship. So the first cases we saw in this country were related to those Americans who were brought back home after being exposed there. We have now, however, begun to see cases that have popped up in our communities in certain parts of the country and are not really known to be caused by anyone who traveled. There seem to be no links for several of the cases in California and in the state of Washington, also in Oregon. These are cases in which people just became sick in their community and presented to a hospital and ultimately were found to have coronavirus. So we know that we're having some disease circulating in certain parts of the country. There's around 16 or 17 states now that have reported cases, most recently in the state of Tennessee today. So besides Tennessee, we have cases we know in Georgia and in Florida. So Alabama's almost surrounded. We think it's probably inevitable that we will see cases here. One of the big problems with identifying them has been getting the testing for the virus readily available. Our state lab here in Montgomery has worked really hard to get staff trained and to get the tests ready to go. And actually, we have just learned today that we will begin testing really any minute. So we're meeting later today to work on the strategy we're going to use for who gets priority in testing and how those tests are going to be collected and transported and done. And so we hope to have all that information ready by tomorrow. There are going to be other folks testing in our state as well. Academic medical centers, for example, have the ability to do this. There are tests that have already been developed in other parts of the world that they are using. So we will not be the only folks who are doing testing in the state, but we are the first to be testing in the state, and we know that we'll probably find cases once we have the ability to look for them more than we've been doing. We've been preparing since mid-January for the possibility that we would have a case. We stood up the first part of our incident command system, sort of activated our all-hands-on-deck approach to get ready for that back in January. We started reaching out to providers like doctors and others to give them the most up-to-date information and guidance on how to manage and diagnose and treat someone with the disease. We've done several calls with our hospitals and have several more upcoming to make sure that they're prepared to deal with the possibility of having an outbreak of coronavirus in their communities. And this is not only just to assess their ability to take care of people who are sick with a serious illness, but really almost as importantly to make sure that their own healthcare workers know how to protect themselves from a disease that can be easily transmitted to healthcare workers as well. We feel like the hospitals are ready. They've done a very good job of preparing and getting ready for this. We have reached out to other groups as well, including the nursing homes, to our EMS providers and ambulance services and those who work there like paramedics and EMTs. We've done a lot of outreach to schools, to businesses, to law enforcement and other first responders, to other folks in the community that will have particular needs and questions and issues that arise when we begin to see cases at some point. So we have developed a plan that we've shared with the governor's office that really sort of has triggers built in for how we will respond and what sort of public statements the health department will make depending on what numbers of patients we see. For example, when we have been talking for a few weeks now about organizations and individuals reviewing what emergency plans would be, how to protect themselves in case of an outbreak. But when we see our first case, we'll become a lot more concrete with our recommendations. So schools, for example, might be asked to cancel extracurricular activities or sporting events. Hospitals may consider delaying some elective procedures or elective surgeries to try to preserve capacity in the hospital. If we move to a situation where we have a lot of cases in Alabama, then we have recommendations for those situations as well. So you can imagine we could see a situation like where schools are trying to teach kids from home, using computers or tele-teaching, for example. Hospitals may be able to activate their crisis care plans, which lets them deal with large numbers of patients should that become an issue. So right now, we have not seen any cases. We hope we do not see any cases, but we think it's our role to be prepared and to make sure that we know what we are going to do if and when we encounter these situations. So with that statement, I'm going to stop. I'd love to hear questions from you. We'll take as much time as you would like and try to answer any issues that you've heard about or would like us to try to tell you about. Thanks.
No questions related to coronavirus just yet.
Okay, great. Well, obviously, I really covered that well because no one has any questions, but we'll give you a little bit of time in order to be able to do that. I would mention that we're fielding a lot of calls here. Our ID&O staff are answering the hotline when people call for information or guidance or when those folks have concerns. And there's a large volume of calls that they have to handle, dozens of calls per day. And so we continue to try to get the word out to educate people so that they understand where they can go for resources. I want to remind you that our own website has a lot of great resources. All of the types of outreach that I mentioned to you are listed there, and you can sort of see for yourself or refer other people there if they would like to get the specifics of the advice that we're trying to give to people. We're planning some continued outreach with schools, for example. I've talked to the superintendent of education, and we are planning to get in touch with state superintendents very soon to try to answer their questions about coronavirus. There are a lot of other specific organizations and agencies in the state that have a lot of individual concerns. So we have been meeting with other folks, other state agencies to try to understand what their needs are and try to make sure that they have their plans in place as well should we have an outbreak of disease. For example, one question that comes up has to do with working from home or telecommuting, which is not something that state employees do in most cases, but that might be an example of something that we would consider asking state personnel about should we have a lot of people with illness. So that's just one of the many things that we have looked at. Anything else has come in so far? Or?
Still no question.
Okay, well, we're doing great. I'm glad I've been able to answer all your questions. I'll give you just a couple of more items before we close. The federal government has been obviously very interested in how we would address this problem. The U.S. Congress has passed a large funding bill that actually went through the House of Representatives yesterday and through the U.S. Senate today, almost in record time. The president's expected to sign this supplemental appropriation any minute, we hope, hopefully today or certainly by tomorrow. This would free. This is a little bit of new money, but mostly moves money around from other places. But it'll be over $8 billion in funding that'll go to folks like the CDC, and CDC money mostly goes to state and local health departments. So we believe we'll have some resources to deal with issues as they come up. Some of the money goes to the National Institutes for Health, who are working on drug therapy for coronavirus, who are working on vaccines and other types of medical interventions as well. Some of it goes to the Assistant Secretary for Preparedness and Response to work with emergency preparedness programs. The hospital preparedness program, for example, is funded out of this, and this is a program that our Center for Emergency Preparedness worked closely with hospitals to make sure that they have capability to deal with certain types of emergency situations. So we are optimistic and appreciate the fact that the federal government has come on board and is trying to get us resources to do this. All right.
We do have a few questions.
Okay.
The first is a two-part question. What can individual families do to prepare for the virus outbreak, and what basics do we need to gather?
Yeah, thank you. That's a great question. At the moment, we do not have any cases in Alabama that we know of, as I said. And so the advice we're giving everyone is exactly what we tell people every year during flu season. Do those things that will prevent you from getting sick, such as practicing cough etiquette, covering your cough when you cough, or covering your nose when you sneeze. Wash your hands frequently. Be careful about touching your face, because that's how most people become sick. They get a germ off their hands onto their nose or mouth. Remember to stay home if you're sick. I really can't overemphasize that enough. Many people feel like they don't feel too bad, so they may as well try to go to work or try to go to school. And that's really the way that other people become infected. So if you are ill, please stay home. Particularly if you have any chronic health problems yourself, be careful about being in large groups of people where other people may be sick. Just use prudence and use good judgment about avoiding those folks, particularly people that you know that are sick. And finally, I would say don't forget to get your flu shot if you haven't done that already. Even though it's March, it's not too late for a flu shot. The flu shot doesn't work for coronavirus, of course, but it does work for the flu. And so when we're trying to decide if we have an illness circulating in our community, it's much easier to do when we don't have an outbreak of influenza going on as well. Finally, we want you not to have the flu, because that just consumes additional resources from physicians and hospitals and other healthcare providers who have to take care of flu cases when they may need to be caring for something else. In terms of preparing, I don't think that this is a crisis that you need to build a bunker for in your backyard. We would give you the same advice that anybody in Alabama should have. We're a state that has a lot of issues that come up with weather, for example, like hurricanes or tornadoes. We have ice storms in the winter. From time to time, we have these situations when people need to be self-sufficient for a little while. So I would just say use common sense and do the things you always do to be prepared. Make sure you have some canned goods and some drinking water and a good flashlight, and just be prepared to stay at home a few days would probably be the worst case scenario.
We have a couple other questions related to out-of-state travel. Both individuals are basically asking for the trips that they're supposed to be taking, should those be canceled?
Yeah, I'd say it probably depends on where you're going. We've had people here, I know, in our office who've canceled trips simply because there's a lot of work to do about coronavirus, and has nothing to do with where they're actually traveling to. At the moment, there are no travel restrictions in the United States. Again, we would encourage everybody to use common sense. For example, Kirkland, Washington is kind of the epicenter of coronavirus in America. I don't have any plans to go there soon, and you probably shouldn't either. But other than that, I don't think there's any reason to be overly concerned. Coronavirus is not circulating on a large scale in the U.S., not right now, although that certainly could change. So I would just say be aware of your environment. Think about where it is you're planning to travel to, and try to determine whether there's any illness in that community.
And this question is there any concern for family pets with COVID-19?
Yeah, so that's a good question. We don't know exactly how this virus affects pets, but probably animals are capable of contracting it to some degree. There's really just not good evidence as to how serious a disease that would be. Probably it came to humans from animals of some kind originally, and a lot of human viruses aren't exclusively human. They also can end up in animals as well. So again, I would just encourage you to use the same general precautions you do with the health of your pet. But at this time, we don't have a reason to be overly concerned. I would add that one interesting thing about this infection is it does not seem to be a big problem for kids. Children have done very well with this everywhere that it has popped up in the world. So that's a lot different from influenza, for example. Flu is we think of it as a problem for elderly people or people with chronic diseases, and it is, but flu also can be deadly for children. Flu is a big problem in pediatric populations. This coronavirus does not seem to be a problem for kids. They seem to do very well, and it's possible that maybe these are kids who are getting other kinds of coronaviruses all the time, and their immune system is just able to handle it. But almost all of the serious illness and death has occurred in older people or adults with chronic health problems, and not with children.
What advice would you offer to retail stores on sanitation and keeping employees well?
One of the most important things that we have talked to businesses about just has to do with your sick leave policy. Try to have an environment in your business that allows your employees to stay home if they're sick. Certainly if working from home is an option, then that's one thing to consider. But we certainly don't ever want workers to feel like they absolutely have to come in no matter how sick they are, because obviously that's the way that things can spread. So having adequate sick leave, having an understanding HR is a really important thing. In terms of your physical environment, disinfecting to prevent coronavirus is just like every other type of custodial work that you do. There's no particular special chemicals that you need for coronavirus. It is a new virus and it hasn't been completely studied, but we know that the routine cleaning that most folks would do gets all the coronaviruses that we know about, so we don't have any reason to think that this would be different.
Alrighty. I think that's it for questions at the moment.
Okay. All right. Well, I think that's all the questions. So I'll just wrap up by saying thank you very much for what you're doing. We know that you all out there in our county health departments particularly are on the front line. You're getting lots of questions. You're certainly dealing with people in your community who are anxious or who are worried and who don't know what to expect. That's a normal way to feel, and we certainly understand that. But we do feel like we have a good plan in place. We feel like we'll be able to address this if and when we need to do it. And again, thank you for what you're doing.
Before we close,